Great. Welcome, everybody, to our newest webcast. It is my distinct pleasure to introduce my very good friend, Jean-Luc Neptune, MD, MBA. Dr. Neptune, he goes by JL. JL and I go way back. We go back, 20 plus years. We trained together at Columbia Presbyterian in New York in internal medicine. We worked together at Gerson Lerman Group for a number of years, and we started a business together as well. So I consider JL more than a friend, more like a brother to me. So JL, welcome to Quality Reviews. And for those of you who don't know who we are a company that helps health system collect real-time patient feedback, really for the purposes of service recovery and improving patient experience. So wanted to welcome JL. Thanks so much for joining us.
Thank you for the invite, Ed. Good to see you. Hope all is well in California.
Yeah. So you have quite the harrowing story. You were one of the very first people in New York to test positive and actually come down with COVID-19. So why don't we just start there? Walk us through that whole process.
Sure. So it's hard to believe it's almost August, and my COVID experience is many months ago, and it just shows you how quickly this whole situation is evolving. But you are correct. That was one of the first 1,000 people to test positive for COVID in New York. I was living my normal life, and at the beginning of March, was invited to be a speaker at a conference of French healthcare executives who were interested in telemedicine. And, it's crazy to think that, we even allowed this event to happen. Just imagine 50 people in a room that was probably no more than 20 by 20 in size, right? I mean, a tiny conference room in a country that was having an epidemic of COVID-19. And, it's interesting because I remember that day that I got infected. So that was March 7th that I got infected. We were sort of at the point of doing elbow touches at that point. That was like the first event that I had gone to where I was not shaking hands with people. But what probably wasn't clear at that time was that COVID-19 was airborne. There's a clear evidence that suggests that there's airborne spread. You put 50 people in a room, 400 square feet, these things are going to happen. So I got exposed on the 7th, started coming down with my symptoms on the 10th. Was notified like on the 12th that somebody from that French party had tested positive for COVID, and then I tested positive like a day later. And then, I was sick for a whole month. I had 10 days of fever, which is just a brutal experience. And then, after the fever broke, I spent almost like 2 weeks in bed with the most suffocating fatigue you could ever imagine. And, I've dealt with patients, in our old days, we dealt with patients who had chronic fatigue syndrome. And if what those patients had was anything similar to what I have, I mean, that's the most debilitating thing you could imagine. So I spent, the better part of a month in bed, or right next to my bed. Me and my family, I have a wife and 2 kids. We spent like 15 days in our apartment. We did not leave our apartment for 15 days. And then, April 10th, I would say I was finally recovered. And then it took me, maybe another 2 to 4 weeks before I started exercising again. And then since the beginning of May, I've been back to working out and have been getting back into shape. And actually, I'm almost in better aerobic shape than I was before I got sick. But it's been a long road, man. And I'll tell you, this is, as you may remember, I filmed some videos at the beginning of that experience to try to help people understand, like, this is not your common cold. This is brutal. And it's remarkable to me that it's in August and people are still questioning, whether this is real, whether it's as bad as it seems to be. I mean, our kids, we live in New York, right? We have the virus under control here. And it's still not clear if our kids are going to be in school in the fall. So, it's crazy. And I wish we had done a better job as a country in terms of dealing with this situation. But at least from my perspective, I'm happy to be feeling better and to be past this.
Yeah, no, thank goodness you're much better. And, I remember watching those videos and you were literally like coughing as you were doing the YouTube video. So it's, you seem a lot better. So that's really good. I mean, a follow-up to that, I mean, any kind of lingering effects symptomatically or signs-wise?
It's a good question. I mean, look, over the last, so let's say I've been recovered now, May, June, July, 3 months. I have, occasional symptoms that I had during my acute phase. So, like headache was a big feature of it. And I've had that headache come back a couple times. There have been days where I've been very tired. And I don't know, is that because I just did a heavy speed workout that day, or is it because the recurring element of the virus? So I've had some what I call shadow symptoms that come and go. And it's scary because every time you get one of those symptoms, you ask yourself, am I reinfected? Yeah, because we still don't know whether reinfection can occur. If it does occur, what are the consequences of being reinfected? So even now, how many months out, I'm still wearing a mask every day, still obsessive hand washing, still